All right, start recording. Okay. Today is June the 25th, 2022. This is our first South Carolina Native American Health Committee. Want to welcome everybody that's been able to stop their day for us to get this going. I put on here a roll call of seats, but we can see who's on the screen here. John Creel, Dr. Creel is with the Edisto. Chief Nelson, are you able to hear us?
Yes, I can hear you fine.
Okay. The PD and Chief Parr are both on here. Patricia and Brenton are from Commission for Minority Affairs. Felicia is with the Limestone University.
Yes, hi everyone.
Hi. And then Thomas is with us from Urban Indian Health Institute. And welcome, Thomas. I'm going to give you a few minutes to kind of introduce Urban Indian and what we're doing here.
Absolutely, thank you. Oh, excuse me, sorry. I was like, oh, was that my offer? Well, hi, hello, good afternoon to you all. My name is Thomas Lawrence. I'm an enrolled member of the Makah tribe out of Neah Bay, Washington. Sorry, excuse me. And I work with the Urban Indian Health Institute, a division of the Seattle Indian Health Board, where we offer, well, how do I say this? We are one of the 12 tribal epidemiology centers throughout the nation. And for us, what makes us basically the service of a tech is to service the Indian health, well, the American Alaskan Native people residing in their IHS area. And for the Urban Indian Health Institute, what makes us unique is that we survey the urban Indian population. And I'm so happy to be here. Thank you, guys.
Thank you, Thomas. So the next thing on the agenda is the overview of our grant with Urban Indian Health Institute. The goals of the grant, there's 3 goals here: develop, deploy, and expand tribal community health worker services to reach and serve Native American tribes, tribal communities, and tribal citizens, initially in Orangeburg and overarching into areas throughout the state of South Carolina. Number 2 is collect, visualize, establish baselines, and implement ongoing ethical and robust data collection. Achieving this goal will accurately reflect the disparate health needs, implications, and effective solutions impacting life ways and resilience of tribal communities in South Carolina on a lifelong continuum. And then the 3rd is in collaboration with the South Carolina Commission for Minority Affairs, develop the tribal community health profile for American Indians to South Carolina to supplement the Healthy People 2030 statewide initiative. A voice in this initiative was established a presence for South Carolina's Native American population to be more effectively considered in federal and state program development and policy making. The impact, the delivery of health education shapes for tribal individuals and communities that focuses on preventing chronic disease and maintaining proactive solutions for healing. As individuals learn to be proactive in healthcare, communities are strengthened. Measurable outcomes and planning. Tribal members serve through healthcare education activities, expand framework of the community health worker manual, best practices, and emergency manual based on MOU tribal participation. And that emergency manual includes things like pandemics. And then develop a region-wide Native American Health Committee, which is what we're doing today, comprised of representatives from the service delivery area. Develop data collection protocols, tools, and standards for collecting, compiling, and disseminating aggregate tribal health data to inform the tribal health profile for American Indians in South Carolina. The Healthy People 2030 Objectives, which was published by the Department of Health and Human Services, health conditions health behaviors, populations, settings and systems, and social determinants of health. And within the social determinants of health, economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and then finally social and community context. The task that we have today, and I asked Urban Indian Thomas to join us in this today because we have a lot of outreach effort going out, but the tribes are not participating at all. In fact, an example of that, last Monday evening, we did the Sacred Tobacco, Traditional Tobacco versus Commercial Tobacco in Native American Communities webinar. And that webinar was attended by tribal governments, tribes, educators in tribes, health workers in tribal communities in 30 states. And in South Carolina, there was only one attendant, and that was the Commission for Minority Affairs. We don't understand why the tribal participation is lacking so much. Outside of tribal tribes, there's a whole population of Native Americans that are not affiliated with the tribe, and those people we're not having any trouble dealing with. We're getting input from them. We're just not getting anything from the tribes. So we wanted first to address that tribal community engagement. What is it that we need to do to get these tribes to get involved in the health network to promote the programs in your areas so that we can move forward with community needs assessments for each tribal community to start building this final report, tribal community health profile?
Is that an open
Mitchum.
I'm sorry,
Is that an open question to anyone?
everybody, yeah,
Yes.
everybody.
We, I have a free clinic with the Edisto Natchez Cuso tribe. It's the Edisto Indian Free Clinic. We're constantly doing, like surveys, et cetera, and using the data that we gather from the clients or the patients that we take care of. And we're able to share that because we share it with our grantors. So I think maybe having a survey for tribal councils to give out first to the tribal council and then for them to disseminate it in the churches in the community or other public arenas like civic clubs, et cetera, Rotary clubs.
So you want us to send you the survey?
I think the survey, being able to disseminate it at first with the tribal councils and then having the tribal councils with their spheres of groups and entities they deal with, if they're native entities, that would be one way of getting more participation.
Well, I know the survey itself has actually been digitized or made electronic, and it's on our Pine Hill Health Network page. And I know that, I don't remember what capacity Sabrina is in the office or on the council, but she does follow our page and she's fully aware of the online version. So it's not like we're not hiding it, it's online. So I would invite you to go to the Facebook page where it's at, and I believe it's also on our website, but I'll go ahead and send you another, PDF version of it if you want to print it and decimate it.
Okay.
Good afternoon, Chief Mitchum. How are you doing?
Doing well, Brenton. How are you?
I'm doing well. And if you would like to send to me a copy of that, so if we need to mail those out to communities, we'll definitely do that.
That's a great idea. I will definitely do that. Do you want? I'll send you a PDF.
Yes, ma'am. If you send me a PDF version, what we'll do is we can draft a cover letter If you want to send us some language to put in that cover letter to talk about the importance of that survey, and what we can do is we can send that out. And if you want them to return it directly to us or return it directly to you, just please let us know, and we can assist on that particular end.
Oh, great. Okay.
Yes, ma'am.
Chief Nelson, do you have anything that you can add to this? Because we were at your powwow and we had the health fair going and everything else. But there were so many people there that were not from the area. How do we get this into your communities?
Well, I agree that sending us that letter would be great, the survey, and then we can get people to fill it out. You know, this is really new to me because we don't have any kind of health network up in the upstate that deals with Native American people. There's not any that I know of. And so I know that Chief Krill and yourself are doing things in the lower part of the state, but we just don't have anything up here. And so if you could send out that survey to me, I'll get it filled out with some people up here and get it back to you.
One of the things that we've done, and we've done this with the PD, we've tried to do this with Edisto, is to partner with them, is for your tribe to, through an MOU, we would provide the services to your people for free.
Okay, that sounds great. Yeah, just get me that information where that's available, and I'll send that out to tribal people.
Okay, and also, this goes to the community health worker programs that we have. Again, they're free. We actually had to see it. It's a referral sheet.
Okay, I can see that.
And the bottom referred by, and since our programs are health education based, they're monitored by a physician. You don't have to be a physician to refer somebody to a program. And in fact, you can self-enroll yourself. Now, another thing, Britton, maybe you can help us with this. We have the Health Network brochures that have all of our programs in them. I can send you a couple of boxes of these, like send out.
Yes, ma'am. That would be great.
Or do you want me to scan it and y'all could put it on your website maybe? Or I don't know. Maybe we could just send a couple boxes.
Yes, ma'am. If you send boxes, we can, and we can also have another meeting to talk about the best way to disseminate that information. But if you send that to us, we can definitely utilize that when we go out throughout the state to make sure that information is spread for you.
Okay. And
Chief
so,
Mitchum, Chief Mitchum, if you would send me, just a couple of copies, if nothing else, send me a couple of copies of that and also the other paperwork that you had in your hand, and so that I can look at it and pass that information on to other people.
Okay.
And Chief Mitchum, PD Indian Tribe would like copies of that stuff too.
Okay. And Chief Nelson, did you, and Chief Frill, did you want a referral pad?
Yes, please. Go
Okay.
ahead and send me that also.
And I guess Chief Nelson, did you or Chief Frill want to entertain an MOU?
For me, that would be dependent upon the council would have to make that decision. But I see no reason why we couldn't work together and of course, our tribe, we don't do the MOU, but our clinic is open to anyone with no insurance or underinsured, and they're welcome to receive care at our clinic. We do have a Facebook and a website. We do have some brochures that we're in the process of updating because of some new staff. So those will be available soon as well.
Now, my understanding as far as free clinics go, based on your website, you only serve 4 counties.
We see some patients in other states as well. You know, it's the primary counties would be here in the Low Country, but we take care of patients even from other states. I even have some patients, missionaries that come from Alaska and Africa, you know, so different places. We take care of anybody without insurance or underinsured. The primary focus is the Low Country, but we're open to seeing anybody without insurance.
And would you, again, we talked in the past about working through telehealth. Did you come to a decision on it? We talked about it a few times. Have you made a decision on that yet?
I do not do telehealth at my primary office in Walterboro or at the clinic. I would have to investigate a little more. You know, my time is limited with my wife. She's recovering. And of course I'm the director at the free clinic as well as the chief and the owner and primary physician at my practice in Walterboro. But I definitely could talk with you about working out some details for that. Mondays and Fridays will hopefully be open sometimes in the mornings in the near future.
Okay, well, I'll just wait to hear from you about that, because we would have to bring you on through Medicare to be able to do it. And as far as our brochures and the referral, can you give me an idea how many brochures you would like for your office?
Just if you could provide some, just maybe 100 or 150 to start, and then we'll go from there.
All right, and Chief Nelson, about the MOU, do you want me to draft one and send it to you so you can look at what it looks like, and we can talk about it later?
Yes, let's do that, because, you know, this is all new to me, so I'm not familiar with the process. So I need to learn more about, you know, all of what's going on, and send me some copies of that too. I'm going to be sending out a letter, you know, some of our tribal members here in the next 3 weeks, especially the ones that's within about 100 miles of my location. And I'll include a copy of that in that letter, so that, you know, some of our members are down towards your area anyway,
Yeah,
and I can get those copies to them. And we got a few members down in Georgia too, that's not that far away from you. So when I send out those letters, I'll include a copy of that in that letter.
okay. All right, now, did we lose? I think we lost Pete, but John? Is it John? Rick, I'm calling John. I'm sorry. You want us to just pack up everything and send it to you as well, except for you, we already had the MOU, and it's unfortunate we weren't able to get this done last week while y'all were here, but we were gonna send 5 blood pressure monitors over there so that they would be readily available for the people who are participating in the blood pressure program. So I can go ahead and box those up along with the weight scale to send over there for y'all. Would you want me to send?
Yeah, we need a copy of that MOU or, you know, kind of a draft so we can see, because as you know, I'm just finding out about this. So I kind of need to look everything over.
Okay.
And yeah, but you can send that on over along with that.
Y'all should have a copy of it already. should have,
Who,
because that was done a couple years ago. Chiefly, yeah, he might. Well, we'll get with y'all,
well,
figure out about where it is.
well, I've talked to all of them. They said they don't have a MOU on it.
We'll just send you the emails back. We have them.
Okay.
And then the final thing is, this is another form, that we did, the,
Okay.
another data collection tool that we have. And this is what we showed y'all last week when you were here. Chief Nelson, this is what we had. And so I'm sure, you know, you probably see it. This is just the, it is for, outdoor events.
Oh, when you got closer, I'm kind of hard of hearing you.
Oh, I'll say that the,
I don't know if you're blocking the speaker or what. Okay.
Yeah, I think it's because of the papers and the way it's blocking. the
Okay.
screen.
Yeah, so the healthcare screen form is basically for the community health worker to record the blood pressure, temperature, O2 stat, height, weight, and pulse, and then other. And then we use this to identify what programs that the person would benefit from in Pine Hill Health Networks list of programs. Do you want copies of this as well? Chief
Yes.
and everybody?
Yes,
Alright,
that would be fine.
I think so. Brenton, did I hear you too?
Yes, if you could if you send us copies, that'll be great.
Okay. So let's see. And of course, like I said, this referral pad, you don't have to be a physician to fill it out. If you have somebody you want to refer, just fill this out and it can be scanned and emailed to us, or the person can go on the website and go through the website, which is the www.phhn.org, or just give us a call. And I'll make sure, you know, we'll send a package of everything to everybody. And again, the programs within Pine Hill Health Network, they are free. They're conducted in person, virtually, or by phone, and a referral can be made by anybody or a self-referral. As to data collection, that community needs assessment. I know we've talked to Minority Affairs about doing community needs assessments in the past. We did our own and came up with our own version of that. Brenton, could I send that to you and maybe you help us send that a version of it out? Or maybe Dr. Creel and Chief Nelson and Rick, we can send you what we have already, because all it is a report card is what we called it, because people don't like filling out surveys. But like I said, that survey is digitized or electronic, whichever the right word is, and it is online. I can email that link to all of you. Would that be better?
Yes, that would be fine.
That would be great.
Yeah, that'd be good. Yes.
Yes, yes, ma'am. If when you email that, I'll also share that with our research director, because he's doing a statewide statistical profile. He's finalizing that, but that'll be helpful information that we can have going forward.
And that's Robert Fenton?
Yes, ma'am. Dr. Fenton. Yes, ma'am.
Yeah, he's helping us with this profile once we get our information together. So I'm emailing the electronic version. All right. Okay, as to the next step, I think we have plenty right now to get to the next step of getting this out, coming back in a month. We don't have a lot of time to get information back. So we would love to get this information out as quickly as possible and start getting data sent back. Let's see, a month from now. July the 25th, which is on a Monday. July the 29th or 30th. The 29th is a Friday, the 30th is a Saturday. Which day is better for everybody?
I don't have my calendar up. I'm on my phone, but generally during the week would be better. But if it works for the group to being on a Saturday, we can try to have someone from staff on call.
Is anyone opposed to meeting in 2 weeks just because since we're dealing with so much that's already electronic and can be, flipped right out? Is anybody opposed to a meeting in 2 weeks so that we can ensure that the electronic versions of things are working?
What is the date of 2 weeks about?
Since we have the electronic version of the community health needs assessment, and like I said, it's on the Facebook page and on the website. If we're able to get that out Monday to all of you, and y'all are able to distribute, 2 weeks would be, well, let's say the week of the 11th. This July the 11th, week of, what is that? John, I know with your job, time is precious.
I think I'm going to be actually on a mission trip to South Dakota. Every year we do a youth camp with the 10th band of the Lakota people in South Dakota. 3 reservations. We work those pastors and bring the children to a camp in Aberdeen, South Dakota. But I should be able to get connect with phone,
Okay.
So anytime should work as long as I have internet service.
Yeah, Chief Mission, July the 11th is fine with me.
The 11th, that's
Yes.
a Monday.
Yes, that would be fine.
What
Let's see.
time can we do that in the evening? Would that be better, like 5 o'clock or 6?
Yeah, if you're in South Dakota, you'd be, what, 3 hours
About
behind?
2 hours, I think.
So if we said 5 p.m. Eastern, that would be 3 over there.
Yes,
Would that be all right?
that would work.
All right, so July the 11th. We're gonna say 5:30. That way, people who are working can get off of work. 5:30 p.m. John, that would make it 3:30 for you.
Chief Mitchell, would it be, would you be able to send me a text like about 30 minutes before so I can prepare? Just because I'll be tied up with everything going on I'm the camp physician and the director, but I'll be able to find a place to get away and have connection.
Okay. Does anybody have anything they want to share? At this point, because I know that finally getting this health committee moving. Creating it was not the issue, it was moving it forward was the issue. And we decided to just go ahead and do it because we could not get the quorum we needed at the minority affairs level in their meetings. And I did talk to Dr. DeCosta about holding an executive meeting. Brenton or Patricia, do you think that we would need to have any one-on-one meetings or an executive meeting called of the advisory council for the Native American Affairs division?
We can, it might be best to schedule a call with Dr. DeCosta and kind of go through those details.
Okay,
Yes, ma'am.
all right. Felicia, I hear you want to talk.
Just briefly here. Chief Mitchum and Chief Nelson, Limestone is in Gaffney, which is in the upstate, and I'm pretty well connected with the Rotary clubs, you know, there, and I yield to your expertise, and so I obviously want to follow your lead. But you know, one thought is to maybe potentially connect with them, and I think that they would be a very strong advocates. So I was this year's past president of our Rotary Club in Blacksburg, South Carolina, and I mean, it's one of those things that I think they, not by design, not the big, that I, you know, necessarily was like, yeah, I'll do it, but they're like, you know, would you go another year? So it looks like I'll be at least helping out this upcoming year. And so that could be something that could be advocated. And so if there's a way that you want to work with the Rotary clubs, and particularly in the upstate and beyond, I think that that could be a viable possibility. So.
And what we'll do, Felicia, is we'll send you a copy of everything too, so the youth can get that out in that area.
Okay, great.
And also, I know one of the other things that we're working on, and this involves our health network programs, is through the NDPP program, through our blood pressure monitoring program, through the Super Kids Club and Indigenous First Steps, and our obesity mobility program for physical health, is we track physical activity. We feel like that should be something that's included in this assessment or in the health profile. And I think that speaks, and Brenton helped me with this, it speaks more towards the economic environment that we're in. For example, this area, when you leave this little spot, there are no sidewalks to walk on, nowhere to ride a bike. You know, there's not a whole lot of places to go for physical activity. And I believe that that would strengthen our report. I know that, for example, Dr. Creel, where you're at, you kind of have the same problem. There's not a whole lot of places to go to do things and exercise and be physically active. And the same is up in the Marlboro area for the PD. Chief Nelson, I don't remember exactly, is there a specific location that your tribe is like headquartered in? Or
Yeah, up here in the upstate, we've got, you know, lots of activities that people have for exercise. There's a lot of trails up here in the upstate, in Spartanburg and Greenville counties. They run all the way to the mountains. There's a lot of parks up here, so there's no shortage of places for people to exercise.
Okay.
Yeah.
And so we can, yeah. And I think that would be vital to include that in the profile to be able to nail down that the reason for such little physical activity is the lack of places to go to be physically active. Now, I know for myself, I'm disabled. Washing dishes and doing laundry is my physical activity. So,
Hey, that's good. Research supports that, by the way.
so, all right, well, does anybody have anything to add? Do you have any questions, comments, criticisms? I'm open to criticizing myself all the time. Go for it.
Well, I just want to kind of piggyback off of the comments just previously made about, opportunities for physical activity. So Chief Mitchum and I have been talking about a grant that I'm working on that will really, I think it's a broad base, but one of the things that I think it will help is through some of this rural active living assessments that we can tweak towards the Native American population. I think it can help assess challenges like lack of sidewalks, lack of lighting, lack of accessibility, to increase and to want to engage in physical activity, whether it's structured or lifestyle. And so I think that, I know we need some information now, but I think the good news is that, we're kind of preparing to build a foundation that we can hopefully be able to assess and address these challenges. And so, it's exciting. I think there's some real opportunities here to address, the honest, sincere needs of the Indigenous community in South Carolina and beyond. And so I think this is the time to have these types of conversations.
Wonderful. I agree. Let's see, Chief Nelson, did you want to add anything else?
No, I appreciate the opportunity to learn from you and Dr. Krill and Chief Krill and the others, and try to provide information out to individuals that really don't have health insurance or the ability to go to a doctor. And what you guys, both of you are doing is just outstanding, I think, for Native people. And I greatly appreciate what both of you are doing.
Thank you.
Both appreciate it. Dr. Crow, did you want to add anything?
Looking forward to getting this ball rolling.
Absolutely wonderful. And how about the PD? We are in love with PD.
Yes, everything sounds good. Just get us the information and so we can look over everything. And like I said, I'm just coming on board, so looking forward to see how all this turns out.
Now, Rick, everything we're sending to you is going to include the blood pressure monitors and the weight scale. Does that get sent to you directly? Or is there
no. Where would we send that?
Well, that's a good question. I reckon here, or
Well, it could send it to me. Yeah, you can send it directly to me.
Okay, what I'll do is I'll get in touch with you through the Facebook
Okay.
Messenger, because I don't even think I have a phone number for you. I'll get your information here in a little bit.
Okay. All right.
And Patricia and Brenton, thank you for both being here from our Commission for Minority Affairs. We're looking forward to our continued working together on all of these programs. Do y'all have anything you want to add to it? I want criticism. I get criticized in emails all the time, but I don't get it face to face. Do you have anything to add?
Will you do
No,
a,
ma'am. I'm sorry,
will you
Chief. Go
do
ahead,
a
please.
health- I'm sorry. Will you do a health committee meeting email group email so that we all can correspond together? And once I complete our updated brochure, I could share that as well.
I wanted to add too that while a lot of the tribes, all of the tribes were invited, and I have been saying all week that we are not getting into the who's who or who should be who or any of that. The people that have appeared today, you have your seats at this committee. If you have someone else you want to take your place, please let us know that. The tribes that have not participated today for whatever reason, whether it be an internet problem or whatever, their seats are still at this table. They're just going to be listed as vacant. We're not cutting anybody out, and we're not getting into the nonsense that I see happen everywhere else. But we will do the group email. But you know, I just wanted to reinforce that as far as the committee seats filling, this is the committee right now. Hopefully on the 11th, we will have a better attendance and these seats will continue to fill up. And Brent, go ahead and, was it Brent?
Oh, no. Yes, ma'am. No, I was just saying thank you. I think this is a really informative meeting, so definitely appreciate it.
Thank you. Well, I appreciate everybody's time this afternoon. And Dr. Krill, I know you said you were trying to do 3 meetings at once. I've done that before. I don't envy you. I do appreciate your attention to our meeting. PD, thank you. We hope that
Thank you.
we hope that we get this information to you as quickly as we can. I think you've got some regalia coming too. Chief Nelson, thank you for your time. Dr. Cavallini, welcome to Native country in South Carolina.
My pleasure, my honor.
And I would love to help facilitate getting you in touch with Minority Affairs with Mr. Brown and Ms. Gaillard and the Native American Affairs Division.
Absolutely, absolutely.
We can tweak out the rest of it. It is 1:49 p.m. Unless anybody has anything else to add, I don't. Except I'm going to be busy all weekend.
Call after this meeting.
Thank you.
That's good. So I'm going to stop the recording now.